Welcome to a new episode of Medicine in 3 minutes. We go straight to the point. The subject is briefly made clear and often illustrated. Today's topic is the vagus nerve. The vagus nerve, or the pneumogastric nerve, is the 10th cranial nerve, logging the parasympathetic control to lungs, the heart, and digestive tract. The vagus nerve are paired, but are normally referred to in the singular. It's the wandering nerve and the longest nerve of the autonomic nervous system in the body. Often leaving the medulla oblongata between the pyramid and the inferior cerebellar peduncle, the vagus nerve passes through the jugular foramen, then extend into the carotid sheath between the internal carotid artery and the internal jugular vein to go down to the neck, chest, and abdomen. The right vagus nerve gives rise to the right recurrent nerve, laryngeal nerve, which hooks around the right subclavian artery and ascends into the neck between the trachea and the esophagus. The right vagus nerve contributes to cardiac, pulmonary, and esophageal plexus. It enters the diaphragm through esophageal hiatus as posterior vagal trunk. The left vagus nerve enters the thorax between left common artery and left subclavian artery to descend to aortic arch. It gives rise to the left recurrent laryngeal nerve, which hooks around the aorta to ascend between the trachea and esophagus. The left vagus nerve further gives off thoracic cardiac branches, break up into the pulmonary plexus, continues into the esophageal plexus, and enter the abdomina in the esophageal hiatus of the diaphragm as the anterior vagal trunk. Here's the right vagus nerve and the left vagus nerve. The right vagus nerve hooks under the right subclavian artery to give right recurrent nerve, and the left vagus nerve hooks under the aorta to give the left recurrent nerve. Crossing the esophageal hiatus, there is two branches, anterior and posterior vagal trunk. This is at the level of lumbar 1. Here is the aorta. Here is the inferior vena cava. The pharyngeal plexus. To understand the pharyngeal branch of the vagus nerve, the principal motor nerve of the pharynx arises from the upper part of the ganglion nososome, which consists principally of filaments from accessory nerve, pharyngeal nerve of the level at the constrictor muscles, which divide into filaments that join branch from the glossopharyngeal nerve, external laryngeal nerve, and sympathetic fiber. Together they form the pharyngeal plexus. Branches of the plexus are distributed to muscles of the pharynx, except the stylopharyngeus muscle, which is innervated by the glossopharyngeal 9. Muscle of the palate, except tensor vidi palatini, which innervated by maxillary nerve V3. Filament to hypoglossal nerve winding around the occipital artery. Here's the pharyngeal plexus that gives main trunk of the vagus nerve. This is the external superior laryngeal nerve, and this is the internal superior laryngeal nerve, and it ends as recurrent laryngeal nerve. The superior laryngeal nerve descends, divide into two branches, the external laryngeal nerve and the internal laryngeal nerve. Superior laryngeal nerve divide into two branches, internal and external branches. The external laryngeal nerve supplies the cricoid muscle. The external branch function to tense to the vocal cord by activating the cricothyroid muscle, increasing pitch. The internal laryngeal nerve is the internal branch. It descends, piercing the thyroidomembrane in company with the superior laryngeal artery and is distributed to sensory branch to the epiglottis, the base of the tongue, mucosa membrane of the larynx, entrance, and vocal cords. Let's deal with the nuclei of the vagus nerve and afferent and efferent fiber coming from this nuclei. There are afferent fiber which take the nerve impulse toward the nuclei, and efferent fiber which bring nerve impulse toward viscera. Let's start with afferent fiber. There is three categories of afferent fiber. GSA, general somatic afferent, GVA, general visceral afferent, and SVA, special visceral afferent. To memorize this fiber, we put 3A as afferent, 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 2G as general, general, and 2V as visceral, visceral. Then we add S and S. GSA, GVA, and SVA. All these fibers are coming from viscera to nuclei. There are three nuclei for afferent fiber: the spinal trigeminal nucleus, the dorsal nucleus, and the nucleus solitarius. Fiber coming from the air go to the spinal trigeminal nuclei via general somatic afferent. Impulse coming from the larynx go through GVA, general visceral afferent, to the dorsal nucleus, and stimulation coming from the epiglottis go to the nucleus solitarius via SVA, special visceral afferent. Now we deal with efferent fiber coming from nuclei. There are two nuclei, the dorsal nucleus and nucleus ambiguus. Fiber coming from dorsal nucleus as efferent fiber to pulmonary plexus, cardiac plexus, esophageal plexus, and celiac plexus. All these fibers are coming through GVA, general visceral efferent. On the other hand, fiber coming from nucleus ambiguus carrying stimuli through SVE, special visceral efferent, to muscle of pharynx, constrictor muscle, plexus muscle of larynx. Let's recap. Three types of afferent fiber: GSA, SVA, and GVA. And two types of efferent fiber, GVE and SVE. GSA, they bring pain, temperature, and touch from the external air, external auditive canal, and tympanic membrane. They go to the superior ganglion before they meet the branch coming for the meninge to go to the spinal trigeminal nucleus. Stimulation coming from the epiglottis and little bit of pharynx are coming from SVA to the inferior ganglion before they go to the nucleus solitarius. Parasympathetic GVA fiber coming from the pharyngeal plexus are going to the dorsal nucleus. Now we talk about the efferent fiber. There is two efferent fiber. GVE fiber coming from the dorsal nucleus to the pharynx and larynx, and SVE coming from the nucleus ambiguus to the pharyngeal plexus through the jugular foramen for a constrictor muscle and muscle of the larynx. Afferent fiber, there are three afferent fibers. GSA coming from the air to the nucleus spinal trigeminal, from the epiglottis through SVA fiber to the nucleus solitarius, GVA fiber from the pharynx to the dorsal nucleus, and there is two types of efferent fiber, SVE and GVE. SVE coming from the dorsal nucleus to the cardiac plexus, pulmonary plexus, and to the GI tract. SVE coming from the nucleus ambiguus, they go to the palatine muscle, constrictor muscle, muscle of the pharynx, and muscle of the larynx. We start by SVE fiber coming from the nucleus ambiguous. They go to the pharyngeal plexus. They connect with fiber coming from, of course, the vagus nerve, glossopharyngeal nerve, and accessory to form the pharyngeal plexus. Then they give the superior laryngeal nerve to all muscle of the larynx, and then it gives branches to the constrictor muscle, include the superior, the middle, and the inferior constrictor, except the styloglosopharyngeus, which is innervated by glossopharyngien, and give a branch to muscle of soft palate. All muscle of soft palate are innervated by the vagus nerve except the tensor palatini, which is innervated by V3, maxillary nerve. Levator palati, palatoglossus, palatopharyngeus, muscle of uvula. All these muscles are innervated by the vagus nerve except the tensor palatini, which is innervated by the maxillary nerve V3. All muscles of the pharynx are innervated by the vagus nerve except the stylopharyngeus nerve, which is innervated by the glossopharyngeal nerve. All muscles include superconstrictor, inferior constrictor, salpingopharyngeus, and palatopharyngeal. All muscles of the larynx are innervated by branch of the vagus nerve. This is the cricoid cartilage. This is the thyroid cartilage. Two arytenoid cartilage. Muscle that connect cricoid cartilage to arytenoid cartilage are cricoarytenoid muscle. Muscle that connects two arytenoid are arytenoid oblique and transverse muscle. Muscle that connect cricoid and thyroid cartilage is the cricothyroid muscle, and muscle that connect arytenoid to cartilage thyroid is the thyroarytenoid muscle. All these muscles are innervated by recurrent nerve except the cricothyroid muscle, which is innervated by superior laryngeal nerve. This is the superior laryngeal nerve. The cricoarytenoid muscle, they open vocal cord. Arytenoid oblique and transverse muscle, they close vocal cord. Cricothyroid muscle, it extends vocal cord. The thyroarytenoid muscle, it turns the vocal cord. All these muscles are innervated by recurrent nerve except the cricothyroid muscle, which is innervated by superior laryngeal nerve. The second category of efferent fiber are GVE, coming from the dorsal nucleus. From dorsal nucleus, there is a parasympathetic fiber coming to gland secretion for esophageal plexus, for cardiac plexus, for contraction and secretion of bronchi of pulmonary plexus. The right vagus nerve give branch to celiac plexus and to GI tract until the transverse colon. The left vagus nerve give the plexus, the hepatic plexus. I repeat about the dorsal nucleus. Dorsal nucleus, it sends fiber to the gastric plexus, celiac plexus, cardiac plexus, gastric plexus, and GI tract until the transverse ascendant. The left vagus nerve give only plexus, hepaticus plexus for the liver. The right vagus nerve and the left vagus nerve connect to form the esophageal plexus. And there is the anterior vagus nerve. Here is the diaphragm. What about cardiac plexus? There are two. There are the superior cardiac plexus and the deep cardiac plexus. The superior cardiac plexus, there is fiber coming from the pneumogastric, and from the sympathetic. It's the same for the deep cardiac plexus, fiber coming from the sympathetic and from the pneumogastric. Here's the right pulmonary plexus and the left pulmonary plexus. They connect with the left esophageal plexus and the right esophageal plexus, and they connect with the posterior gastric nerve and the anterior gastric nerve. Now there is GSA fiber coming from the air to the spinal trigeminal nucleus. GSA touch pain and temperature from tympanic membrane, external acoustic meatus, and the skin behind the ear. Fiber has auricular branch to the superior ganglion of vagus or jugular ganglion. Then to the jugular foramen to give an auricular branch, which is meningeal branch, a little branch that supplies the meninge. Then it comes to the medulla, to the spinal nucleus of trigeminal nerve. Let's move on to GVA. GVA coming from the carotid body and carotid sinus, go to the jugular foramen, to the dorsal nucleus. Similarly coming from the mucosa of larynx below the vocal cord, go through the recurrent laryngeal nerve to the dorsal nucleus. Similarly coming from the upper part of the larynx, go to the internal superior laryngeal nerve to dorsal nucleus. On the other hand, GVA fiber coming from dorsal nucleus go to the cardiac plexus, which is formed by superior branch, inferior branch, and thoracic branch, to slow down the rhythm of the heart. Fiber coming as GVA fiber to the lung for contraction and secretion, and fiber coming to the mucosa of larynx above vocal cord from the internal superior laryngeal nerve. And the fiber coming from the recurrent nerve to the mucosa of larynx below vocal cord. Let's review. Afferent fiber, there is three categories: GSA, SVA, and GVA. Coming from the air to the spinal trigeminal nucleus, from the epiglottis to the solitary nucleus, and coming for the pharynx to the dorsal nucleus. Afferent fiber, there are two. SVA fiber coming from the nucleus ambiguous to the soft palate to constrictor of the pharynx, and for all muscle of the larynx. And afferent fiber as GVA fiber to the cardiac plexus, pulmonary plexus, and GI tract. Thank you for watching this episode of Medicine in 3 Minutes about the vagus nerve. Would you like to click the like button and subscribe? Your comments are very welcome. Thank you.